My name is Melissa Pummell, and I'm going to go over a newborn bath with you today. What you need to gather first is you need to have a hairbrush, a thermometer, cotton balls, Q-tips. You can have a water basin, is fine, soap, lotion, washcloths, and you want to make sure you have a soft place to lay the baby. Now, what you will do is put water in your basin. You can fill it up to about this line, make it about 2 inches deep would work. And then you can put your soap and your lotion in there to keep it warm for the baby. And next we will get the baby. First thing that you want to do is you want to check baby's temperature to make sure they're not too cold. Check. Okay. And at this time you can go ahead and get them undressed. You can do this with gloves or without, whichever you feel comfortable with. And you want to make sure to keep the baby wrapped in the towel to keep him or her warm. And what you're going to do is basically hold them like a football. And before you put any soap in your water, you want to get a washcloth, just the warm wet one, and you want to wash their face. Wash down around their cheeks, down their nose, over their mouth. And then you take a cotton ball, give it a little wet, wipe from the inside of the eye to the outside. And then you can take a Q-tip and you want to clean the ear. You do not want to stick this in the ear, just clean the outside of the ear. And then at this time you can go ahead and add your soap into the water, and then you take your washcloth and you're going to start with the head. Start with the head. You can even use the brush if there's a little bit of what they call vernix, which is the dry skin after being being delivered. You can use the brush, rub it around, and it'll help get all that extra stuff off. And then you rinse. And then you want to take a dry towel and dry it. Every time you wash a place, you want to dry it. Then what we're going to do is we're going to work down the baby. We're going to go to the neck. And you're going to want to clean in those creases really well, because this could be, if you don't keep it clean, they could get an infection in there. Rinse it out. Make sure they're dry. And then you can start with washing the baby's arms and the chest. One of the easiest ways that you could possibly do this is you can set your baby down into the water, and then you're going to take your rag, you're going to wash the chest, and wash the arms and the hands. Any little crevice or crease, you want to make sure you get that nice and washed. And always hang on to the baby. And then you take your other rag and rinse it off. And you can take this and dry up here, dry the arms, dry the hands, dry the chest off. And then you can wash the legs and the feet. And then you can roll them over. And you want to wash their back, dry, or rinse it off. Then you want to wash their groin area and their buttock area. Best way to do this is go ahead and pull them out and make sure they're good and dry. Their back is dry. Then you take your washcloth from the soapy water and you wash from front to back so you don't make any infection, especially if it is a girl baby. And then you want to dry it off. And then you can take your lotion and you can rub it all over the body, the legs. Just do not put any on the hands or the face of the baby. And then you get a new diaper. And with the diaper, you want to make sure that it goes underneath the umbilical cord, because you do not want it to cover the umbilical cord. And you can also make sure you clean your umbilical cord. Depending on the doctor, each doctor is different. Some will say you can use alcohol to clean it off. Others can say just regular soap and water does fine. And then you'll get the clothes. Twist it here. Let me straighten the clothes out. And you want to reach through, grab their hand and pull it through. Get your blanket so you can swaddle them nice and tight. Keeps them nice and warm. And that is how you do a newborn bath.